associated with hormones, right? Nothing new. Most people recognize that hormones have a lot to do with sexual appetite. Indeed, that's true. We talked of the endocrine system early in the semester. I told you about the pineal gland. But I paid special attention to the master gland of the body, which is what? Which of these is the master gland of the body? Does no one remember that? The pituitary gland. Thank you. The pituitary gland. This one way up here in the brain, right at the base of the hypothalamus. Now, to keep it simple, so if that pituitary gland is malfunctioning in some way, or damaged, worse still, what you're going to find, it's going to affect everything else in your body, because that's the master gland. So you're likely to find that the gonadotrophins are basically your gonads, right? So your sex hormones. Your sex hormones are going to be low. And so hypopituitarism is simply low functioning pituitary gland. And if you have hypopituitarism, then your sex hormones are also low. But there's something else that actually happens independently of what's going on in the pituitary, and that's called menopause. In menopause, as you all know, and we talked about this in cardiovascular disease, right? Women's risk of getting heart attacks and strokes increases dramatically after menopause. Why? Why is that so? Why is the risk of cardiovascular disease in women so much higher after menopause, after about 50 or 60? Because of estrogen. To be specific, because of the diminution or the decline in estrogen. And it turns out that same hormone, estrogen, is important for sexual appetite. And that is why women, after they cross about 50 or 60 years old, find that their desire to have sex is just so much lower. Now,